First, we need our mojo back. Let's start with things that are really critical to the nation, where we think we might be able to open without getting into a lot of trouble. I tell you, schools are a very appetizing opportunity. I just saw a nice piece in The Lancet arguing that the opening of schools may only cost us 2 to 3% in terms of total mortality. And, you know, that's any life is a life lost. But to get every child back into a school where they're safely being educated, being fed, and making the most out of their lives with a theoretical risk in the backside, it might be a trade-off some folks would consider.
Back in 2020, when COVID was taking more American lives than we could keep up with, Dr. Oz told Handy that if we opened schools, we'd only suffer an appetizing 2 to 3% of total mortality, which translates to around 6 to 10 million deaths. I guess it's this kind of concern for American health that got him tapped by Trump to run Medicare and Medicaid services.
It's a new nomination from the president-elect. He wants Dr. Mehmet Oz to be the CMS administrator. He is saying in a statement, the president-elect, that Dr. Oz will work closely with Robert F. Kennedy Jr. to take on the illness industrial complex and all of the horrible chronic diseases left in its wake.
I think about a week and a half ago, people stopped being shocked at the caliber of people that the president-elect is nominating to run some of the most vital aspects of the government. Dr. Oz is another Trump guy with a name that he still thinks is marketable, but let us know during the pandemic that he doesn't really know what he's doing.
Yesterday, you were on with us and you said that so far you hadn't heard of anyone that was taking it consistently and got coronavirus. But then yesterday you said, if you are, send me an email, find a way to get in touch with me, write it on my social media.
We had one tweet from one person saying she thought she had COVID-19. I'm following up with her. Again, one more time, if you have had COVID-19 and you have lupus on this medication, hydroxychloroquine, which most of the 300,000 patients who have it are on it, please reach out to me, droz.com. I just want to understand if you've actually had the illness and why it happened. It might be that it reduces the incidence. It might reduce the symptoms of it. We're not sure, or maybe no impact at all. We'll call it the kill meat hypothesis. But if it's out there and it's real, let's learn from that.
I mean, he's got the right mindset when it comes to the way he sees people that can't afford the exorbitant costs of health insurance.
Now, when you go home today, what should you do? I think you ought to think about 15-minute physicals. Your local hospitals will fund these. They're incredibly inexpensive to run. You can screen thousands of people for almost nothing, and you allow a conversation to take place in more of a festival-like setting. It's not scary. And I mentioned earlier that almost everybody who comes to our 15-minute physicals has a job, but a lot don't have insurance. Give them a way of crawling back out of the abyss of darkness, of fear over not having the health they need, and give them an opportunity, because they don't have the right to health, but they have the right to access, to a chance to get that health.
He said uninsured people don't have the right to health. But if we give them a festival-style 15-minute check-in, it'll be inexpensive and give these folks the opportunity to somehow have access. He said all this thinking that he's proposing a good deed for the people unworthy of health, but didn't think about what happens if someone that gets a diagnosis would need some treatment next. He doesn't care. As long as they come off looking like they care without actually providing care, his job is done. So again, he fits in perfectly with this administration that sold fake concern in the middle of clear dismissals.
Many of the accusations made against RFK Jr. just do not hold water. You mentioned the vaccine example just before I came on. You're absolutely right that 3/4 of young adults do not qualify for the military. I mean, President Trump is promising to this movement, Make America Great movement, that he wants to make us strong and safe, and with Maha, make us healthy. You need all three, right? If we're not healthy, we can't defend ourselves. If our young people can't serve in the military, we're not going to be able to do our best to keep ourselves safe from foreign intrusion. And this is the kind of issue that health has become in this country.
I remember the MAGA talking point that was driven home over and over that claimed Trump isn't a warmongering president, that as long as he's in charge, the world sits back and does whatever he tells them to do. But Oz has gotten the talking point that's already selling the opposite message. The reason we're rightfully looking to address harmful ingredients in our food is to make sure we've got some strong military-aged men to defend the country. And considering the only invasion Trump ever talks about is the one that calls all migrants military fighters, we can see who he's focused on attacking. Now don't forget though, Oz lost the Senate race to John Fetterman because he couldn't find a bit of relatability to regular Americans.
Thought I'd do some grocery shopping. I'm at Wegner's, and my wife wants some vegetables for crudité. Here's a broccoli. That's $2. Not a ton of broccoli there. There's some asparagus. That's $4. Yep. Carrots. That's $4 more. That's $10 of vegetables there. And then we need some guacamole. That's $4 more. And she loves salsa. Yeah, there's salsa there. $6. Must be a shortage of salsa. Guys, that's $20 for crudité, and this doesn't include the tequila. I mean, that's outrageous. And we got Joe Biden to thank for this.
By the way, Trump's plan to lower Dr. Oz's crudité ingredients at the store would include tariffs and mass deportation, leaving him solidly as one of the few people that says tariffs won't raise prices. But he promised without details that he'd do it. So America sat back and believed him. And despite Dr. Oz's failed campaign promise to privatize Medicare by taxing regular Americans more to support the private sector, he might have found an unlikely ally that's suddenly buying his nomination. Manu Raju posted, just spoke to Senator John Fetterman about his old rival Dr. Mehmet Oz, whom he defeated in a fierce 2022 Senate race. On Oz's nomination to head the health agency overseeing Medicare and Medicaid, Fetterman very much open to voting for his confirmation. I'm going to be very, very clear. If Dr. Oz agrees to protect and preserve Medicaid and Medicare, I'm absolutely going to vote for the dude. That's the most important thing for me. Our politics are obviously different, and we do have a history, but I don't have any bitterness. I don't hold anything against him. As long as he's willing to protect and preserve Medicaid and Medicare, I'm voting for the dude. So all Oz has to do is tell Fetterman what he wants to hear, get into this role running Medicare, and do whatever the hell Trump and the private healthcare industry tells them to do. We know this could happen because this guy that looks a lot like John Fetterman told us that's who Dr. Oz is back in 2022 when he ran against him. Dr. Oz is literally at a fundraiser in California today with a bunch of billionaires and Senator Rick Scott, aka the guy who has a 12-point plan endorsed by Oz to destroy Social Security and Medicare. You can't make this shit up. You know, it's crazy that all Oz has to do to erase that image of him sucking up to donors hell-bent on siphoning more cash from Americans for their profit-driven healthcare is to say, never mind, I'm on board, John. Now, I get the energy from Democrats to make sure that they don't look like they're opposing Trump picks simply because they're Trump picks. But backing a guy that you told voters is bad for Medicare doesn't make you look cordial or magnanimous. It makes you look like you don't have any principles that support your constituents.
Fetterman has won statewide in Pennsylvania. He's got that going for him. He doesn't dress like a normal politician. He's always wearing hoodies and he wears shorts. He wants to legalize marijuana, I believe.
You know, there are not enough Pennsylvanians to work in Pennsylvania. So giving them pot so they stay home is not, I don't think, an ideal move. I also don't want to breed addiction to marijuana. It's not physical addiction, it's emotional addiction, but I don't want young people to think they have to smoke a joint to get out of their house in the morning. We need to get Pennsylvanians back at work. You got to give them their mojo.
Dr. Oz's biggest problem was he was running for a Senate seat in Pennsylvania. He lived in New Jersey.